So welcome everyone to the October 5th, 2020 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Grafton Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet is present.
Josh Briggs. See him yet? No. And then Dr. William Muller, which I know Nancy, you said he was going to probably be a few minutes late, and I don't see him on here yet either. So we'll keep going though. Staff, when I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
All right, and then anticipated speakers or participants on the agenda, please respond in the affirmative after I call your name. Danielle Edmonds from the Alliance.
Here.
And then DJ Wilson.
Here.
All right, so I would like to open the meeting now. Can I get a motion? And then as a reminder, we do roll call voting. So I can get a motion from a member first.
This is Dan Finn. I make a motion to open this meeting.
Can we get a second?
This is Austin Magnet. I'll second that motion to open the meeting.
All right, and then roll call for a vote.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gwiazdowski-Govin, aye. All right, so good evening again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12th of 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting, based on the topics, I don't think there's any topics that would feature public comment, but if there is anyone on, we'll get to how you can submit questions regarding a topic shortly. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and with that may also be able to see what is on your computer if you do select the screen share option on your computer. So anything that you broadcast can be captured by the recording. All supporting materials have been provided to members of this body are available on the town's website unless otherwise noted, and the public is encouraged to follow along using the posted agenda unless I were to note otherwise. Before we turn to the first topic on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. So I'll introduce each topic and if there's an associated speaker or participant on the agenda. After any remarks are concluded, we will ask the board members if they have any comments, questions, or motions, obviously. And then just general webinar, web meeting guidance, mute your phone or computer when you're not speaking, and then speak clearly and in a way that helps generate accurate minutes for Nancy's sake, if nothing else. So if there's any dialogue, responses back and forth, standard practice to yield and wait until the chair yields the floor to you. Obviously use your name before speaking. If there is anything where there is public who would like to comment on it first, any public comments that have been submitted in advance for a topic, which there have been none, for this meeting will be read out, and then if there's someone who would like to provide any public comment or question on a topic, please use the chat feature in the Zoom meeting, which can be monitored, and then we'll address those if they come up and as they come up. Please use your full name and your address, similar to how if we were all in person, that's something that we do when you came up to the podium or the chair. And then any votes taken during the meeting will be taken by roll call. So with all of that being said, let's actually get over to the first topic. So that is the Alliance update. So Danielle, you're up.
Great. So Danielle Edmonds from the Alliance. This is actually my first formal meeting, so hi, everyone.
Welcome.
Nice to meet you, I guess, air quotes there.
Nice to meet you.
But yeah, with the monthly Alliance update, specifically with the environmental health. So our first bullet is COVID-specific complaints. We are getting ongoing, complaints across the Alliance. Typical complaints are residents reporting lack of social distancing in businesses, shops, and restaurants specifically. That's probably one of our biggest complaints there. And with those complaints, we do follow up with educational visits, and we do give calls to those businesses just to go over proper, COVID compliance and the requirements. And we really do. We want to thank Nancy for fielding all those complaints and doing the best she can. She really is doing great. So thank you, Nancy.
We thank you every day.
Thank you, Danielle.
So yeah, and then with the COVID reopening guidance, it continues to be updated across the sectors. As we all know, it's ever changing. So definitely we're staying on top of that. And depending on your community's color, some sectors can move to phase 3, step 2, and others can't. So again, dependent upon your community's color dictates that. And we continue to monitor twice a week calls from DPH and send out bullets to the Alliance. So, and then EEE and WNV. So the 2020 Arborvirus Response Plan is up and available, and there is a new website for educational material and other guidance. And that website is www.mass.gov/mosquito and ticks. And just, it's really big to remember the 5 Ds: dawn, dusk, deep, dress, and drain. So yeah, and some North County areas have received frost, but there is no new update on EEE cases. So yeah, that's it on my end with the bullets.
Right. Any questions, Dan, Austin?
Danielle, nice to meet you. This is Dan Finn. Yeah, I guess we're pretty much out of the mosquito EEE season, but not so much, not quite yet with the West Nile virus. So for instance, for Halloween, I think, we're still going to have to recommend that people go out if they're going to go out, during the daylight hours. Do you get any updates from the Central Mass Mosquito Control Project at all as to their progress or work?
I personally do not, but Phil might. That's something that I would definitely double check and get back to you on.
Yeah. Yeah, maybe we've just been lucky actually.
Don't jinx us, it's not done yet.
Right, true. We're not out of the woods, so to speak. But anyway, thank you.
Anything, Austin, for Danielle, or are you good?
I'm good.
Does everyone have Danielle's report?
Yes.
Yep.
All right.
Oh, so I should go over that next, correct?
Yeah.
Okay.
Hello?
Yep.
Okay, great. Yeah, so food inspections, it's all listed there. Haven't really had too many problems, just a couple establishments that, further education is required and some re-inspections are are going to happen. We have reinspection coming up this week with one particular establishment. But other than that, everyone's been pretty good, food code wise, and following the COVID guidelines. Everyone's, doing the best they can with that. And if they do have a question, they definitely have been reaching out to ask for clarification, which I appreciate. Does anyone have any questions with the food inspections about any particular establishment?
Danielle, this is Dan again. I'm just curious, what is Firehouse Seafood? They participate in the farmer's market, but what is that?
So yeah, that was a particular vendor at the farmer's market. They're from Hudson. It is actually a fresh seafood and bakery. So I inspected them last week, and they were great. They had fresh seafood and baked goods at their table. So yeah.
Thank you. They must have some kind of refrigeration or ice, I imagine, and
Yes.
for their seafood. Thank you.
Yeah. They have proper coolers. Yes.
I had a quick question, Danielle. I noticed that number 7, it said required further education. Oh,
Yeah.
Could you elaborate on that?
Yes. So with that particular establishment, the majority of the help English is not their primary language. So definitely there's been a little bit of a language barrier there. The owner does speak both English and Chinese, but I did recommend that the workers there do participate in another food handling class.
Okay.
That is in their language to help, because a lot of the reoccurring issues are basic food safety practices. And I think if they see that in their first language, it would come across easier and they would remember it better. So that's what I mean by that.
Okay. Yeah, absolutely. That makes total sense. Thank you.
Hi, Dr. Muller. I think I heard you jump on right when Austin was asking his question. Welcome. We were just going through the Alliance update. A lot of it obviously COVID related. Then we were just touching on the report that was sent over with updates, food inspections, et cetera. So, and Danielle, Phil, who you've been in most of the meetings with thus far, is on vacation. So Danielle from the Alliance has joined us. So. All right. Any other questions, anyone, for Danielle before we jump over into tobacco regulations?
No, thank you.
All right. Thank you very much, Danielle. You're free to stay on if you want to listen in to any of the topics or provide guidance. It all depends on what your schedule obviously is.
Right. Yeah, I can stay on for just to listen, because this is my first one. And if anyone has any other questions, sure, I'd love to be available.
Awesome. We're happy to have you. All right, so tobacco regulations, which is a continuance from our last meeting, when DJ Wilson is back with us again tonight. He's graced us with his presence, and also, just as important, provided us with the drafts that he had mocked up for the 2 regulations that we have. So everyone should have received those. I forgot exactly what date you sent them out on, Nancy, but I know they were sent out.
I don't remember what the email said, Karen.
So I'm thinking, DJ, I don't know, was it easier for you to kind of just, because I know when I looked at them, there's certain things that you very graciously highlighted, like here's what the state law updates are versus here's what we have for questions / maybe are unique to Grafton. So it's probably easier to not even, not that I disregard the state changes, but those we know we have to be updated to match. I think it's probably best use of the time, unless obviously members have questions on some of the state updates, to go through for each of them where you had questions for us, and then which would entail potentially needing, I know we talked last time about needing maybe a public hearing for a couple things.
Okay, so yes. Oops, sorry, perfect timing. Can't wait for the campaign stall to be over. Things stop calling me at dinner time. Maybe if I could start with the ETS one, the secondhand smoke one, just because it's a little easier. So yes, the intent was just to, I know it's a lot of color, but I didn't want anybody to, go on and like put red circles around every definition that's different, when in fact I'm just aligning it with the new, either the new state law or the new DPH regulation that further gives more guidance to the new state law. And so the first place in the secondhand smoke regulation that I do have a question is that under section 4C, there's a bunch of places that you've gone beyond the state law, Grafton has, and gone smoke-free and mandated a smoke-free situation. So number 18, you do have clubs written in there, and I just wanted a clarification if that meant private clubs. Now, this may have been, one of the problems too is I don't have my physical files sitting at home because I'm not.
Yeah, hear you about that.
So I don't have that history. But so two things may have happened. You may have actually intended private clubs, and that's great if that's what it is. I'll add the private club definition. If you didn't intend private clubs, now's a good time to have a discussion and you can, amongst yourselves, to figure out if your private clubs in town are all smoke-free right now anyways. They may have all gone smoke-free on their own if you didn't intend private clubs.
It was intended because I've been around for 14, 15 years now doing this on the board, and it was private clubs because I remember when we did implement that and some of the fun conversations around it.
Okay, so if it's okay, what I'll do is I'll go through and I'll just add the word private club and membership association. Membership association is actually the term that's in the state law, and
Okay.
add that corresponding definition from the state law to that.
Thank you. Yes, that one I remember vividly.
Okay, I'm sure you did. If there was private clubs, it wasn't an easy go.
Yeah.
And then section 8 in variances. We recommend cities and towns don't put a variance in, but some cities and towns just do it automatically, so they do. And so this would be a call for the board. If you've not used it yet, and it's hard for us to figure out how you would use it without getting yourself into trouble. So if you've not used it, you may want to just consider getting rid of it. So
Yes.
they
I'm
only
trying to think of, and Nancy, I would look to you virtually to, I can't think of a time that we've used a variance related to this.
I don't think we have. I really don't think we have.
Yeah. Yeah, and honestly, I
No.
don't remember why that was, that part I don't remember, probably because there was nothing contentious about putting variances in as an option.
And at this point, at the beginning of this, when things were, it was hip and cool to have sections of restaurants be smoke-free. So it was a new world. There may have been some variation to a type of restaurant that we just didn't know about. But now that so much is smoke-free and it's been so accepted, and it actually has a very high level of self-enforcement. So,
I mean, obviously, I've looked to Dan, Austin, Dr. Muller, any
Yeah, I just
concerns
have
with removing that piece of it?
this is Dan. I think it makes sense to keep smoke-free private clubs, but I believe they on the premises, for instance, they could go outside to a picnic table outside of the building, correct?
yes.
Right.
Yeah, so the actual Supreme Judicial Court decision that in favor of the town of Athol did the inside, and they also did a buffer zone within 15 feet of outside. There are very few cities and towns have adopted that buffer zone, just because your private clubs all look different, especially when you start. You look closer to the Athol than, Worcester does.
Sure.
So it was a tough thing to police. It was a hard thing to figure out who had 15 feet and who didn't, if the picnic table was 12 feet away or 20. So, yeah, we have.
And then one other thing, which is a little peculiar to Grafton, and I don't necessarily think it has to be addressed, but we have an Indian reservation. I don't think the local boards of health have any jurisdiction over them. That's not even the state. That might be a federal situation.
It's their own tribe rules. Yeah.
So we don't even want to put it in.
For smoking, we run into this, and that's why the Connecticut casinos are allow.
Oh, yeah.
Smoking, but the Massachusetts casinos do not. And if Wampanoags ever figured out how to classify land as theirs and opened a casino on it, they would also have that same choice as the Connecticut casinos.
Or even if they had an annual event and wanted to smoke a peace pipe, I think they would be allowed to do that by their, or whatever kind of pipe.
And if they decided to do something more formal and you had questions about it, certainly contact us and we'll walk you through it.
Thank you.
Austin, Dr. Muller, either of you for this one, for the ETS side of the world.
No, I think it's fine. I know we had this battle at the hospital where people would go out onto the sidewalk because
Oh, yeah.
town property, and so we didn't really initially accomplish what we were trying to accomplish because they were, very public in their use of tobacco products. They were off our property.
And how's that going right now? A lot of hospitals themselves have
Well, I
policy.
think it's a lot better now. I think, as you're alluding to, I think there's a great deal of public acceptance now that there wasn't, 10, 15 years ago.
Right. Okay, so just to clarify on the variance section, what would you like to do?
This is Dan. It seems to me we want to skip it completely unless it comes up as opposed to stirring the pot, so to speak, or.
Well, what do you mean, like skip it completely? Like I was suggesting remove it?
Yes, that's what I mean. So add the private clubs and remove the section 8. I don't know what anybody else thinks. What do you think?
I think that would be okay. I mean, you don't want to encourage variances, right?
Right.
Yeah.
And this will still be a draft, so if someone barked.
Yeah, we'll send these through town council, like anytime we do this before, they get set in stone with us adopting them, and then we'll have, where needed, the public hearings out of the world, obviously, just like we did back when we actually put the private clubs and stuff in there, so.
Okay. And so what I'll do for this one, as well as the other, is I will I'll take out variances. I'll take out the green, all the green, and I'll leave the yellow in just in case you had someone who, wondered why the definition's different, so they'll just understand that. But I'll also send a clean copy to you. So
Okay.
if you are a board that typically signs something that you pass, it'll be done for you.
Perfect.
Yeah.
Thank you.
Okay. And then for the sales draft, I did the same thing.
Mm-hmm.
And so the first place we get a change is in the adult-only retail tobacco store definition in section C. And so the decision, and I'll tell you, I'm leaning to just having this discussion with the small team of us that update the model regs endlessly. Is just to get rid of this decision altogether. The idea is to not have a store, and we had Cumberland Farms aim to do this in Hyannis, to put in just temporary dividers in the store and call one side an adult-only retail tobacco store and other the convenience store. So we thought if we said, if you couldn't have a adult-only retail tobacco store within so many feet of a retailer, then they couldn't do that. So we're actually recommending 25, just, you know, because that's the purpose of this. And so and you probably have you are not a population dense enough city to actually have these competing stores being that close either. So
Yeah, nothing is coming to mind that they're that close to each other.
That was the intent of this, is to stop this dividing the store in half. I mean, we are fine with the store. What we tell stores is, if you want to divide in half, we're going to treat you just like you're across town from each other. You know, separate cash registers, employees, doors, licenses, permits, the whole bit. And so this is just to keep that from happening. Cumberland Farms backed off and stopped this idea in Hyannis, by the way.
I had never even heard of that. Just, huh?
Well, you know, I mean, we're seeing a lot of we always have a whack-a-mole going, and right now it's hookah bars are trying their hardest because they're part of phase 4.
Oh yes,
trying their hardest to figure a way to be open.
I've heard. I mean, we don't have any in town, so at least we're not
as I said, I think I said
with
last
that.
meeting is that, you know, Worcester wins. There's only 25 statewide, and Worcester wins the award for having the most. Not Boston, Worcester.
Wow.
So we have like, you know, 8 of them trying to figure out how to maneuver to open at any given time. So I'll go with 25 there.
I say, yeah. I mean, unless, like I said, any board members have any other thoughts than the suggested 25.
Nope, I like the 25 idea.
Okay.
Sounds fine to me. Yeah.
And then I think there's only I think a lot of the green has to do with smoking bars. So it's, you know, your option if you want to ban smoking bars altogether. So this would be the common name for them they started out as cigar bars because there was no such thing as hookah bars at the time that the original 2004 state law went into effect. And then now it actually technically can be vape bars as well. So we have a lot of cities and towns that have banned smoking in smoking bars or banned smoking bars altogether. There's been no legal suit to date. And so there would be this definition. It would be a new section in section F. And then there's a couple places further down that smoking bars gets either put in or taken out, depending on what you decide. And so there's a lot of the green is dedicated to smoking bars.
That's what I gathered when I looked through them.
And so it's really a call if you if you're not interested in having any in town. Some of the reasons for not having any is if they are in a multi-use building, say they're in a strip mall and they share walls with other businesses. We had this problem in Wakefield where there was a rare coin store next to a place that was allowing smoking. And so that kind of thing. And sometimes it could even be a residential situation. That happened in Springfield. There was a condo above a smoking bar. And so that's one of them. And it's also kind of, one argument would be to not have your restaurant and bar population that is already smoke-free to then complain that somebody has this advantage in town that they don't. Even though there are strict rules, DOR requires strict rules to become one. And that's one of the problems for them not being able to open up right now during COVID.
I think, and I have to pull it up, I'm trying to as we speak, our existing regulations, trying to think, did we already say no cigar bars?
No, in these ETS, where you oftentimes find this, you didn't. Oh, I'm taking it back. You do. I'm so sorry.
So I was like, this is bringing, maybe not all the way to the vape and all of that, you know, but the
Okay, you have a
redefinition, I'm like,
better. You have a nice long-term memory that works well. So yes, you have it in there
my
already.
husband calls it an elephant's memory.
Okay.
Not
So
necessarily.
what I
the
would
vape.
recommend then, if you're going to keep it, and I assume you would, is that I will incorporate smoking bar in all the different places in this regulation.
All right.
All right?
Yeah.
Okay. Sorry for taking up all that time.
No, don't worry.
And then lastly, it was the next question would be section E9. And that had to do with maximum number of permits. I just wanted to double check that you, I think you already have a cap on the number of permits you have, and just checking on 12. And I just formulated this a little differently to add a new subsection that makes it clear that a buyer of an establishment that already has a permit is not subject to the cap. They can capture the seller's permit. You know, they have to fill out a new application, pay the fee, but they can capture that permit. And it's not to put, frankly, it's not to put you under the gun of the selectman's eyes when the seller runs to the select board and complains about that they had to lower their price by $500,000 because the buyer can't get a tobacco sales permit. So, I mean, the capping is not meant to be a cliff dive off the number of places that you have in town. It's supposed to be a gradual reduction in the number of places that you have. And so that's why that's there. So it's really technical. So it was 12 is what you were at?
Yeah, I just pulled it up. I figured I'd keep it up while I was looking at it for the smoking cigar, whatever we were calling it, bar at the time. So yeah, we had it at any given time. There should be no more than 12.
And you're good
tobacco.
with it. Okay, so I'll keep the 12, ungreen it. I'll ungreen 9C too. And so in reality,
Would that prevent certain retail establishments from opening up in town? Like say Cumbies wanted to do another one. Would that?
what you have in place already, what it does mean is that they wouldn't be able to open up near a school.
Right.
And if you've met your 12, then they could go on a waiting list.
Okay.
Kind of like alcohol.
The other option, and Cumberland Farms is well aware of this kind of way to do it. The other option is that the savvy potential store owner would ask for the whole list of 12 and find the one that, you know, that cigarettes is just like a small part of their business. It's no big deal. They'd happily, you know, for a certain price would turn in their license for the,
Well, if there was a new, say, strip mall going up in town, I wouldn't want to hinder the certain amount of businesses that went in there. But
Right.
Not that I want to also have a lot more, you know, tobacco selling places in town. I just wouldn't want to hinder certain retail growth.
Right. I mean, we would like you to, you know, obviously from a statewide point of view, we'd love you to keep the cap, but also keep in mind, this is actually a change. People, you know, boards will dither back and forth, 12, 13, 12, 13, and they'll lose so much sleep over it.
Right.
But in reality, if you just put it on your next agenda, you could raise the 12 to 13 with a vote like this. It's, you know, this isn't the bylaw that has to go through town meeting.
Yeah, okay, totally.
So, but okay. So I would say, you know, I would say in the end that you actually have so few green updates to do that I'm not sure even holding a hearing is necessary in my estimation.
Yeah, because we're not, my opinion from dealing with these in the past is leaning the same way just because we're not now deciding to ban smoking bars. Yes, the definitions changed a little bit. The private clubs was already done. It just needs the clarification of the fact that it's actually private clubs, et cetera. Yeah, I mean, I can, you know, after we get the final, pretty much, versions of it, when we reach out to town council, can pose that question, say, here are really the differences. Does town council for some reason feel this would ever warrant, really having a public hearing, knowing what the changes are, not including the actual state changes, obviously.
Yeah, I would say the one substantive change is removing variances. That would be really the only difference.
Yeah.
Okay, so what I'll do is as I said, I'll update these. I'll still send you a color-coded one in case you do go forward with a public hearing, and a clean copy of each.
Yeah. All right. Well, thank you very much again. We all greatly appreciate it.
That's it.
Obviously, if any questions come up along the way when you're making those, feel free to reach out.
Okay, that's good.
but-
That sounds good. Well, thank you very much, and have a good night.
You too.
Okay.
You too.
All right. So next up, COVID-19 updates. As of October 5th, my notes, I wrote the 4th, but I know I saw the update come through today. We're still holding at 119 total confirmed positive cases since this started being tracked. As of September 30th, which is on a weekly basis on Wednesdays, the state will do their updates to calculate and color code every community in the state. We're at a green status for the COVID map. That was because we did have that uptick over those 2 weeks, that slow kind of incremental uptick of a case maybe a day or a case every other day that fell within that 14-day time frame that the state captures based on their equation and calculation. So we're back up to a green status. If we hold, it's not getting another uptick, I would envision we would come back down to a gray or white, depends on who you talk to, status. And there are definitely towns around us that are green or yellow, Worcester's a red status right now. So we're, in this with others. And our counts aren't actually, when you start comparing us to the areas around, are not anything abnormal by any stretch. Danielle pretty much mentioned already, so I'm not going to repeat it, the recent reopening for the towns that are not red, like ours, where you can go now phase 3, step 2 of the reopening process. So I'm not going to state that again. And then Danielle, I want you to confirm one thing for me once I say it, just to make sure that my understanding is correct. I know that if a community is red status, take a Worcester, for example, or a Boston, they have to have been not at red status for 3 weekly reports before they can shift over to phase 3, step 2, correct?
Yes, so as of today, yes, that is the
Yeah, I know.
guidance.
Everything is as of this moment.
Right.
On the flip side, and I don't think it's been talked about as much because most people are worried about getting off of their red status if they're in the red status, but I was thinking about this. If a town or a city is not in red status and then goes, unfortunately, to red status, then my understanding is that those facilities, the gatherings, the activities, whatever was kind of allowed per step 2 of phase 3, say roller rinks or bigger performance capacity, has to revert back, and the community and its businesses and activities within it have to revert back to phase 3, step 1.
Yes.
Until they have those 3 non-red weekly reports where they could then go back into step 2, at least as a current state.
Yes.
Okay. I hadn't heard as much about the what happens when you do hit red, unfortunately. after this was announced, but that was my understanding from what I had heard and seen. But I just wanted to get confirmation from someone else that, you know, is even closer to this than we are at this point. So, okay, thank you. All right. Any questions from the board members on COVID-19 updates before we jump over to the next topic?
No.
All right. All right, next topic is, since we are now in October, Halloween recommendations. So this year, as we all know, we don't just have potential Triple E and West Nile concerns like last year, but now, of course, we have the more pressing concern of COVID that is still with us. So focusing first more on the COVID side of the world, the state and the CDC had released guidances regarding Halloween activities. The common things that we've all been hearing for months now, wearing of masks, and not just Halloween masks, wearing of the masks that actually help with COVID, practicing social distancing, hand sanitizer usage, all of those standard practices, along with, I know the state especially was talking about, like, because at a state level, we have all the gathering restrictions, you know, telling people like any gatherings, your activities, et cetera, you have to still follow what the state has for restrictions and guidelines. It doesn't just disappear for a requirement just because it's Halloween. And that's based on the town's color status at when Halloween actually happens, of course, which is a month away, almost a month away, I should say, a good 3 some odd weeks away. So, you know, all of that doesn't disappear just because people are celebrating Halloween. In terms of around us, like what others are doing around us, Worcester, which as previously mentioned during the COVID update, it's a red status. I did read in the news that Worcester's banning door-to-door trick-or-treating this year due to, of course, the elevated risk that they're concerned with in Worcester. From what we've seen between the state and CDC guidances and other towns in the area, I've been hearing, you know, most places are trying to discourage door-to-door trick-or-treating out of the different activities, along with, you know, there's concerns of not having indoor haunted houses, etc. Danielle, from the Alliance towns, have you heard of any other of the Alliance towns like actually banning something like door-to-door trick-or-treating? Or is it kind of what we've been seeing and hearing more around discouraging it, suggesting alternate types of activities, that type of thing?
I have not officially heard of any other towns banning it. I'm in Holden and West Boylston as well. I think as of right now, they are just really pushing, you know, being cautious, the 6 feet, wearing the mask. I don't foresee any of my towns banning it. But I did see like Holden post like alternatives that they could do, but no banning as of yet.
I hadn't heard anything other than Worcester, obviously, which given their status, I, you know, can totally see why they did that. And then, you know, besides COVID, obviously, as I mentioned, we still have to, even though it has been, knock on wood, a quiet Triple E West Nile season for us, unlike last year, we still have to keep that in mind, that, as we all know, a lot of people like to go trick-or-treating, their activities in the later part of the evening on Halloween, especially this year. We have to keep in mind it's also a Saturday, is when Halloween is. So, you know, anything that we discuss and put out, we want to obviously tell people to keep in mind the same thing, similar to what we did last year with the 5 Ds, and recommendations for, say, timeframes and mosquito repellent, etc. Nancy, I know, and I think also I saw it from the Alliance in an email, there was a poster that was developed that I thought was a really nice poster that was developed around, I think this got sent out to everyone, around Halloween 2020, pretty much from the Academic Public Health Volunteer Corps about, the reminders that we just discussed, wearing the face mask, et cetera, the gathering limits. So it's tailored to Massachusetts because it does put in all of the governor's gathering limits, et cetera. And then what types of activities not to do and avoid. So I think at this point I'd open it up to the board members to discuss, because obviously we want to get whatever type of communication out sooner than later, because I know people have been asking. Poor Nancy has been already fielding phone calls.
Yeah, this is Dan, if I can jump in. Yeah, personally, I don't think we should ban it, but I think we should recommend not having the traditional door-to-door for safety reasons. But that poster is quite good, actually. I don't know if you can see that. And it has also at the bottom has some interesting ideas for pre-packaging treats and putting them at the end of the driveway, or of course the old honor system. You hope that works. But in my opinion, we should recommend to discourage door-to-door. But if people want to, that they should abide by the guidelines of the CDC and the Mass Department of Public Health. And if we could get that, if we decide, I don't know if we have to vote on something like that after discussion, but if we can get that information to Chief Crapo, whatever we decide for his column, and also to the Grafton News.
I like the idea of putting the treats outside so that people aren't getting too close to their homes. And maybe even suggesting that people put like a hand sanitizer out next to the bowl of candy so that right before a kid reaches in to grab a piece of candy, he could sanitize quickly. But I also don't want to ban trick-or-treating this year. Just kind of discourage a lot of the social interaction, but also remind them other ways to keep safe.
Yeah, and there was talks of like smaller, like I've heard some people talk about like, well, could we, and I've seen this, suggested elsewhere, if there's a group of, family members that already are getting together during this time, or if it's a couple neighbors where, maybe it's neighbors that are kind of almost like sharing homeschooling responsibilities. I've heard there's all sorts of things that people are doing, and they're already interacting pretty much within each other's houses. There were suggestions that people do like small things like that outside and have even, it's not an Easter egg hunt, but like a little Halloween, hunt or something right within the yard. So it's not like a big, humongous block party or something that people are having that would violate the gatherings rules, but just like coming up with different ideas. And I know I've been seeing a lot of stuff online, not just from Grafton, but just across the country, of what people have been thinking about alternative ways than actually doing the door-to-door trick-or-treating or haunted houses and stuff.
Yeah, that's a great idea. Having a little intimate gatherings with people that you're already kind of quarantining with, so to speak.
Yeah. All right, and then, we should, as part of it, I know that poster's built as part of, whatever gets put out, and obviously we can draft up something. Once, I think we should take a vote, that way it's official, on, recommending versus banning. It doesn't hurt to make motion and vote for it, but I think my opinion is, besides all of that, suggesting, reminding people of the gatherings limit, just like that poster does, to also, within whatever messaging actually gets officially released, whether it be on our website, Facebook page, the Chiefs, is to put in that reminder again of timing during the day for, say, like Triple E, West Nile, because it's not in the top of people's minds,
right?
Like last year's, when it was the big thing on people's minds. So even though, like I said, knock on wood, this year hasn't been like last year, we don't know when we'll have that first hard frost. Just like last year, we have no clue when that first hard frost will come through. Yeah. So rather than having to scramble last minute and be like, hey, don't forget now, 2 days before, you shouldn't be doing this too late in the day. We just put it out there, and if you know, the season ends before then because we have hard frosts, then so be it.
So this is Dan. I'll make a motion that the Grafton Board of Health recommends discouraging traditional door-to-door trick-or-treating this year. However, should children or parents desire to do so, that they try to do so during daylight hours and also follow the guidance of the CDC and Mass Department of Public Health in terms of safety measures.
I don't think I've actually seen the poster, but are there restrictions or, I mean, you could certainly put that in the Grafton News, couldn't you?
Yep, I think so.
And I think that, I mean, I suspect most people in town are, at least have access to the Grafton News. They
Right.
don't subscribe to it. So, I mean, I would think that would be the easiest way to do it. It's kind of, heightening the awareness of it and making some recommendation without really being that restrictive.
Right. And also Facebook and the town website.
All right, so motion, do we have a second?
Second.
All right,
A roll call vote.
roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Oscar Magnan, aye.
Karen Gwiazdowski, Govan, aye. All right, thank you. And Nancy, we can work on any specific wording, obviously, in addition to putting the poster out, so.
Yeah.
All right.
Is there a link to that poster on the Board of Health website already?
No, not yet. I was waiting for this evening's meeting.
Totally. Okay.
All right, so Triple E West Nile, that we covered a good amount of that already. But I keep this on, obviously until the season is actually done. So Triple E and West Nile season is still upon us. So is obviously, I wouldn't say we're necessarily out of tick season yet either. As a reminder, at this point, we're still, there's been some Triple E and West Nile positive mosquitoes in some other counties. There's been some human cases of Triple E and West Nile en masse, but nothing near Grafton for any of the human cases either this year, thankfully. There's still ongoing surveillance of the mosquitoes and services by the Central Mass Mosquito Group. And then, obviously, as was already previously mentioned now a couple of times, different topics, reminded to be diligent while you're going outdoors, especially, looking outside right now. It's getting darker earlier. I think we're at like about a 6:20 something. Sunsetting now, so the days are getting shorter, which means there's less time to do things in the yard after work, etc. So people are stretching it as much as possible. So the 5 Ds again: D, dusk to dawn, drain any standing water, and then dress appropriately. And just a reminder that our website has a variety of resources posted on it around the services of the Central Mass Mosquito Control Project, CMMCP, including how to request tire pickup, any spraying requests, and then also, just as important for people, there's an exclusion form if you do not want your property sprayed. Then next is Tufts Biomedical Permit Extension for 200 Westboro Road. And there's the inspection of Tufts biomedical lab facilities where they do research, and that's been completed. The only reason this is on here actually as a topic is because the payment is still in process for said inspection services. And the permit technically expired on September 30th. We had granted an extension previously to even get the inspections done because of with COVID, Tufts had banned visitors, inspections, etc., like routine type of inspections. So we had granted the extension. The inspection did get conducted within that extension time frame, but now we have the technicality of the permit having expired middle of last week. The payments in process, it just hasn't physically been received by the town yet. So for formality's sake, at this point, we don't want them to obviously be on an expired permit for something as basic as a payment that's pretty much in the mail or in FedEx. According to the last update that I think I saw, Nancy, you might have seen something else.
No,
Is
that was
the-
it, Karen.
Okay. I've been catching up on emails. Is the board willing to grant a short further extension to the permit to cover the time needed for that payment to be received and processed? Nancy, what is the payment already cut? I know as of today, it was going back and forth on the best way to get the check physically to you. But I don't remember if the payment was actually, if the check was cut yet already.
I should have the check tomorrow. If not tomorrow, definitely the day after.
All right.
So this is Dan. I can make a motion to extend it. I'm just thinking for practicality purposes, we should say till the end of the week, the 9th, but everybody okay with that?
There a
Just-
second?
I was almost going to even extend it a little longer in case something happened. I mean, if something would happen, they were to expire and not get the
We'd have to
payment.
come back together again before our next meeting.
Right.
Yeah. And I mean, even if we set our next meeting, it could get postponed a week or two.
So I will withdraw that motion. Maybe 10 days would be the 15th. So could I I'd like to make a motion. This is Dan Finn, that we extend the
Amend your motion, I guess.
amend the motion to extend the Tufts biomedical permit for 10 days from today, which would be October 15th.
Second. Yep. All right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Austin Magnet, aye.
Karen Gwazowski, Govan, aye. All right. Motion passed. All right, thank you. All right, next up, January, February, March 2021 meeting schedule, if we can all think, that far from now. But hey, at least it'll be 2021 that we're talking about, and not 2020 anymore. So let me just pull up. We have 2 meetings in December because we have so many permits to deal with. I think it's December 7th and December 28th. Let me get a calendar up to see what the days actually look like. Hold on. All right. Are there any holidays in January? Trying to look, are there any Monday holidays in January we have to worry about?
Martin Luther King Day is the 18th.
That's what I thought. I was like, I couldn't remember if it was the 11th or the 18th. All right, so we've got that. So we wouldn't want to do / can't do that because of it being closed. So if we do the 28th,
25th, you mean?
maybe the 25th, because the 11th just seems really
I know.
close to the other one.
Yeah,
January 25th work for the rest of you? At least according to what you know right now. Obviously, we all understand things change.
No.
As far as I know.
Yeah.
Quarantine.
Karen,
Yep.
are you trying to go 1 month from the regular December meeting or the signing meeting
No.
in December? Because that's usually nothing on just there for discussion.
Oh, that's right. Yeah. I was just looking at it date to date. Never mind.
Maybe we'll go
Um,
to 11th then.
So then 11th. Yeah. I think
Yeah.
11th then.
Thank you, Nancy.
Yes.
Yeah, I think 11, 8, and 8 maybe.
Let me just look, make sure. I don't think I would have anything that far out at this point. Yeah, I mean, January 11th, February 8th, and March 8th,
For me, yep.
as of right now, looks okay to me. It works for everyone else. All right.
I'm adding them to my calendar.
I know, I'm just like, let me just write these down right now because I'm used to having like the physical piece of paper in front of me, and then I just take that and jot them down when I get
No.
home. I'll shut this down and I'll get to look back up at it. All right, perfect. And obviously, if we find out, that for some reason, who knows what will be happening by the time we get there. For some reason, we have too many, potential vacant, days where it's like, oh, I can't do that, and now 2 members can't meet or something, or some oddball thing where we have like 3 of us can't do it, then we can rearrange and see what's, the best option. But I mean, we're usually pretty good. It's maybe one of us occasionally can't make it, but most of the time it's known. So, all right.
Karen, maybe in the November meeting, you can also decide on the December 28th meeting, I think it was the 28th? Is that
Yeah.
the last meeting?
Yep.
You might not be able to have that meeting. It doesn't look like we are going to be meeting in person for a while yet.
No, yeah.
So we'll have to discuss that in November, how you want to handle the permitting process.
Right.
Yeah.
Okay.
Yeah. Has anyone else been dealing with that in town? That's something to start thinking about, how others have been
Yeah.
dealing with all their permits.
I'm going to check with Cindy.
Yeah,
A lot of her permits expire the same as us.
yeah.
I'll see
Better
what she's
start
doing.
thinking about it now, because it will be by the time it's already, October. So by the time
Right.
we Lincoln, it'll be time to start signing.
Mm.
Okay.
All right. So the final topic on the agenda is the flu clinic / EDS drill. So Nancy, if you want to kind of first walk through where you stand from like the discussions you've had with Mary Ann, and anyone else.
Marianne she may be on there right now. I'm not sure.
No, she's not. No.
Okay. So Marianne, Pam and I
Yeah.
started discussing what should we do? Do we do an EDS or do we just do a quote unquote flu clinic at the municipal center? But then all the emails that are coming through from the state and from the Alliance are strongly suggesting we do it as an EDS site. Drive-through, which would be the high school. You all have the calendar. If that's what you want to do, someone is going to have to run the EDS / flu clinic. It doesn't seem, I've gotten a couple calls where I've said we don't know yet if we're doing drive-through or in the gymnasium. And a couple of people I have spoken to think drive-through is a great idea. That's about,
And then
oh,
do we have any idea when? Because I think there's still the question of when the vaccine's going to actually show up.
no, when I called my supplier last week, they still do not know when they are getting it. So that means they don't know when we will receive it, and they're not guaranteed. We ordered 100, we pre-ordered last year in 2019, 180 doses, because that's pretty much what we go through.
Yeah.
The only thing is now it may be shipped in portions, 30, 30, 30, 30, or 40, 40, or, it could be half and half. They really do not think we would have all 180 all at once. but you
Yeah,
can't plan a date until you have the vaccine.
When,
it's-
just, I'm trying to think, because when do we typically do the clinics?
End of October, I think, right?
Yeah.
No, well, last year we did it in September, actually, I believe. I think we did it the last week in September.
This is Dan. Yeah, it seems to me under the circumstances, we might have to shoot for some time during the first week in November, maybe. I don't know. But also, because of this, if we went the EDS route, the high school is pretty tied up, pretty tight. It would have to be on a Saturday. And I guess that's okay.
What's up for Pam? We're
Yeah.
trying not for
Yeah. And
Yeah.
in,
Pat to
Also-
have to do a Saturday if at all
yeah.
possible.
And she would be sort of a leader from the Alliance, but in that we don't have a leader for the EDS site yet, and that might take a little doing to get somebody on board. I'm kind of thinking we should try the drive-through with the gymnasium as a backup, and it won't involve the school, the old gymnasium. And pick a day during the week in the first week in November. I can't see how you could do it, say it's going to be 3 weeks from now, if we don't have the vaccine and we don't have the setup, but that's just what I'm thinking. I don't know about everybody else.
What's the schedule at the high school? What days do the kids go to school and what days is it closed for cleaning right now? Does anybody know?
I sent your calendar to you. Did you get it, Austin?
Yeah, it was just late this afternoon, actually.
It was late this afternoon. It's color coded.
I got the email. I didn't see the calendar though.
Link.
Yeah, click on the link.
Yeah, it just seemed to me there wasn't much wiggle room there for a day during the week, certainly. And you wouldn't want to have it on a Saturday, Halloween, I don't think.
The only thing with Saturday is Pat's right now is doing 7 days a week. Well, like 20 hours a day.
Wow.
Really, yeah, with the COVID. So she prefers not a Saturday, but she said she will try and abide by whatever you want.
And of course, I'm just looking because I know I heard that schools for many Fridays, but not necessarily all Fridays, are going to do half days, and there's some that are also no school for students and teachers.
Yeah.
But it looks like October 30th is a student half day. But then unfortunately, it doesn't look like November 6th or even November 13th, they're half days. Looks like they're group days. So I would take those aren't half days.
All right, so Orange is no school, right? Students and teachers. So that's November 3rd.
That's
11th.
that's election day.
Yeah.
And then
Oh,
The
and then
11th.
the 11th is
Veterans Day.
Veterans Day.
Oh, and then we have. Okay, so what about an afternoon?
On when?
Okay, so in November, on the 20th, that's a half day. So November, the only day that's a half day is the 20th.
Yeah.
And that seems to be a little far out to me to get the flu shot. If we could get it earlier to people. I mean, to receive it, to have it injected or whatever.
So if you do not do your flu clinic as an EDS, you will have to do an EDS. I think it's in February, March.
Right.
Yeah.
I think it's maybe March.
Yeah, I just happen to think we're going to be better prepared with leadership by then. It's just going to be tricky. Nancy, there was someone that you or Pam mentioned that participated, and he's a fireman. That might be a good possibility. Do you remember who that was? I don't remember the email.
Oh, Karen, was it Daryl Runyon? I don't know if I'm saying that correctly.
Something like that. Running.
Oh, okay.
Yeah.
I don't know who suggested that, Nancy, or
I think Pam sent the email saying that he was very active, or maybe it was Marianne. He was very active in it last year.
right. Possibly worth an ask to see.
Excuse me, this is Dan.
So,
Nancy, when's the next time you're going to connect with Pam and Marianne? After this meeting sometime, I guess, right?
I can tomorrow if you want. The only other thing you could do would be have it at the municipal center, still doing drive-through.
Right,
It just wouldn't be an EDS.
correct. And I personally think that's the way to go, given the short time frame we have. And it's a big job and big responsibility for somebody to take that big book that Debbie was so nice to put together for us, to find somebody that's going to digest that whole thing. It's good. I can see how the Alliance, Katrina, whoever's saying yes, you use it for preparation. I don't think we're quite ready yet, in my opinion. But
So you'll have to be ready then in March.
yeah,
and potentially sooner if a vaccine were available sooner,
right.
Correct.
and not
Nancy-
for COVID. Just gonna
Nancy,
follow
again, this is a tip. What do you think the percentages of seniors? I'm guessing it's probably 60 or 70% seniors that get the flu shot from the town. What do you think?
Yes, absolutely.
Right, 75 maybe. And I think they're used to getting it at the municipal center or someplace close, to go through this whole new walking a great distance through from pylons to roped off areas. It doesn't seem practical to me to put them through that,
Yeah.
Well, either place would be a drive-through, either the high school as an EDS or the municipal center as a flu clinic. Pam had some good ideas last week on, she was going to get an aerial view of the municipal center and stake out, okay, so you've got someone at the entrance, at the top of the hill, you've got 2 people. Do you have your paperwork filled out? Yes, okay, you proceed here. No, you don't, then you have to go over here. Or we could do that the day before. Anybody who does not have access to the internet or who cannot print it can come in the day before, and we will do that for them. And then when they come the next day to the actual clinic, it's just going to flow smoothly because everything will be there. They have to have everything filled out, all the paperwork and the copies of their insurance cards. And if you don't have it, you lose your appointment.
Right. And at the very least, it would be a nice trial to see how a drive-through works, whether you have, I don't think you would need 2 lanes necessarily, but maybe 2 tents or whatever, because we were really thinking about maybe doing that perhaps with a COVID vaccine. But, so Karen, we pretty much have to maybe not pick an exact date, but we don't meet now until the 2nd of November, right?
Yeah, but I'm saying in the past, I don't think we've had to make like an actual motion and vote on exact date of
Right,
a
right.
flu clinic.
Right.
Right.
I mean, we don't even know.
Comes down more to, are we talking a flu clinic drive-through, or are we talking a flu clinic / EDS drive-through? That was the point of this being on there. It wasn't to necessarily pick an exact date, because we have that big unknown of when's the vaccine even gonna get here.
Sounds like a good idea to do it as an EDS, which will give us practice for an actual EDS if we need one.
Yeah,
And
except
it's
for
like-
the hiccup that someone needs to lead that EDS.
Yeah.
Can you describe exactly what an EDS is?
Sure.
Well, it's an emergency dispensing site. So it's a place that people would go to get their vaccine
And how is
or whatever is dispensed.
it different than a flu clinic?
It's just a lot more people.
Picture trying to vaccinate the whole town, hypothetically, when these plans are made. It is to be the ability to vaccinate pretty much the vast majority of the population within a certain time frame.
Maybe 3 days or so.
Yeah,
It'll
and
be-
having,
I mean, it's very supply driven then, right? I mean, at our health center, we used to do a flu clinic that we'd do 1,000 flu shots in a day. But we had, all our staff there. We had, we had, it was, and these were all registered patients to begin with.
yeah, that's not, 18,000 plus people.
Yeah, I mean, I think the interest in influenza vaccination this year is probably going to be greater than it has been.
That's what I was thinking
I mean,
too.
if most of these people are Medicare patients, they really should get the high dose vaccine. And I don't know whether that's what your supply is going to be.
No, we did not order that.
Right. So I mean, so people, I think, if they were to make an informed decision about it, they should know that.
Good point.
So I don't know.
CVS. I know CVS had the high dose, but now they were out of it.
I would say they were out a couple weeks ago, and my dad tried to get it in mid-September, and they didn't know when they were getting it again.
Yeah.
In the Grafton one.
And just putting this out there, the school clinics have already been decided with Pat. The first one being on October 20th, then the 21st, then the 28th. But those are different. That's the state supplies free
No,
vaccine. Yeah. Well, Marianne and Pam are willing to help out at the EDS. And MRC is there to assist the Board of Health.
Right. And incidentally, this is Dan. Dr. Muller, the MRC is a medical reserve corps that Marianne DeFries runs now, and she reaches out to people as volunteers to do immunizations, but also paperwork and people control and that kind of thing. So I guess it would be a good test to see how many volunteers we could get, But
I think that's certainly true. I mean, I think you have to make sure your supply is going to be available. You have to obviously choose a date and then make sure it's going to be adequately staffed so you have flow through the clinic. I mean, a drive-through option, if it was raining or something of that sort, might actually be a problem unless you have a tent or something that people are going to drive through.
Right.
We do have tents that they could just, drive underneath it, and then staff would just give them their shot. I think the decision tonight is, do you want an EDS or do you want a flu clinic? Karen, am I correct in that?
Yeah, and if it's an EDS, because I mean, like I said, we cannot decide on like a hard, fast date, obviously, because we're not going to know until we have a better idea of when that's actually going to show up.
But you have different scenarios planned.
Yeah.
Already planned out.
Yeah.
And then once planned, okay, so this is how it's going to go, then you can just pick the date and someone has to run it.
Yeah. I mean, I definitely like the idea of the drive-through because I could envision, I could be wrong, when the time comes from a COVID vaccine scenario, we're talking about, ideally a large quantity of people, potentially with 2 doses. Sorry in advance, Nancy, for trying to schedule that. And a month apart from each other, depending on which vaccine we're talking about that actually makes it through this, let alone let's not get into the potential storage conditions for some of these that I've been reading about. That a drive-through is a very definite scenario for said vaccine being given to people in the community. Which I'm sure is why some of this is being pushed. Let's try the drive-through option, push it with the EDS side. Sorry.
Yeah, giving it more thought, I guess, maybe we should try to go with the drive-through and the EDS. Of course, that's going to push it onto a Saturday and might limit some of the nurses from the Alliance, but maybe the 7th or the 14th or something in that neighborhood. But maybe if Nancy and Pam and Mary Ann can sort of brainstorm it now, shooting for that protocol or whatever, because it is eminent, or whatever the word is, that we're going to get a COVID vaccine or 2 or 3. So I guess we should try to get ready for it. And I think the Alliance will help out as well, correct, Nancy, with Katrina?
I don't know that. I don't have an answer.
Yeah. Well, they've been big proponents of the EDS for a number of years now, so I suspect they would help out with some energy and some advice,
Well, when you say help out, do you mean physically help out or just?
Like planning help out.
Planning help out, and again, one of the key factors here is trying to get somebody that's going to step up and lead. So we got to try to brainstorm that over the next week or so, I'd say.
Yeah, we have to keep in mind that responsibility was one of the Board of Health members in the past.
Right.
Not someone from the Alliance.
Correct.
Right, one of the Board of Health members has to be the lead with the assistance from MRC and Surat GMO.
I think a lot of that's going to depend on what day it is.
I mean, I could certainly help coordinate some of it, but I'm new to this organization, new to this process. So I, would obviously need to have somebody point me in the right direction. But I do sign a lot of forms for the VNA clinics and things of that sort.
Nancy, do we have the book, we'll call it, from the manual, whatever, guidebook, encyclopedia, pick a term from Debbie.
Oh, the Holy Bible?
Yeah, that too.
Yes,
We call it
do.
that too.
We do. Yeah. It's in the office. I can leave it out in the bin for whoever wants to pick it up and go over it. The front entrance to the municipal center, because it was still pretty much closed to the public.
And I could certainly drop by and look at it. I don't know.
I can leave it out in the bin and you can just pick it up. You can take it home.
I asked for the Bible. Is that
You
Right.
might get some weird looks if you run into someone who doesn't know what you're talking about.
The EDS, the EDS Bible.
Yes, Bible.
Yeah, the EDS Bible. There you go.
I could certainly do that, and then I could email you what the,
Okay.
Yep. Yeah,
And also when I have your business cards. I will leave those out in the
oh, great.
bucket, right?
2 for 1 special.
So what do you want Pam and Mary Ann to do? Set up 2 scenarios? Drive through municipal center and drive through SLU/EDS high school.
Yeah, I think that sounds probably best.
So yes?
Yeah, I mean,
It does sound like they're an
Sorry.
important part of the process.
yeah.
right. I'd say we go forward with the EDS drive-through and EDS. See how far we can get with it over the next week or so, and then go from there. But just to aim for that setup.
I agree. I think that should be the ultimate goal. It's just finding someone to run it, qualified individual with the time to do it.
Nancy, does that get you at least starting in the right direction?
I think I'm gonna have them do both because if no one can step up, there's no point in even wasting your time setting up for an EDS if someone can't step up.
Right. I was telling Karen earlier on a text that a month or 2 ago I would have had time, but I picked up like 4 shifts a week for the next 3 or 4 months, and I don't think I can dedicate the amount of time that's required. But I can certainly help out, maybe perhaps in a co-leader position. So let's see what we can do.
I have a relatively open schedule at this point. I'm headed to the Cape tomorrow, but I'll take the Bible with me.
Light reading on the beach.
Promise to bring it back unspoiled.
That's great. Okay.
What time are you leaving Grafton, Dr. Mule?
Probably around noontime.
Oh, okay. I'll be out front, definitely before that.
Okay.
All right. Pretty much done
What?
there. At this point.
No,
Whoop.
So. Oh. All right, we'll do both scenarios, right?
Yeah.
Yep.
Okay. I know it was Sutton or Millbury that did the drive-through and went fabulous.
Sutton,
And-
I think.
Northbridge. Sutton? Yeah, I think it was Sutton. And also Northbridge
I
drive
think
through.
the VNA, the Milford VNA, I think did it in Hopedale too. They had
Okay.
like a garage that they sort
Oh. You got an airplane hangar hanging around.
we could do it the new DPW.
There you go.
Yeah, seriously.
So get an airplane hangar, anything, but yeah, DPW building, that would work. All right, nothing else old, new. I think the last thing we had was there was one piece of correspondence to read, Austin, that I think Nancy had sent over.
Oh yeah.
Did you send it to everyone, Nancy? Was it with the original agenda you had sent? Not the updated?
Definitely was not with the updated.
Yeah, I know it wasn't with the updated because I'm on the updated looking at it right now. I think it was with the
That's
original agenda. Let's see if I can find it.
It's, the heading is Town of Grafton, bad water sent through
Spelling
pipes. Does anybody recall that one? That was on September 28th.
Oh yeah, I remember reading that.
Okay.
All right, do you still have the email, Austin, so you can
That's what I'm trying to find now.
read it as clerk?
No, I don't see it right now.
Yeah, Nancy, do you have it? Perhaps you could read it for us.
Go on here.
Hold on, I've got it. Hopefully my voice stays because I've been talking a lot today. I'll just read it because I've got it up.
Forward it, Cameron?
What?
Can you forward it? Or do you want me
Yeah.
to look?
Let me grab it because I just shut it. Hold on. Okay, come on. Where is it? I had that's draft. Did I not? I know I have it somewhere.
Yeah, same here. I can't find it.
All right, it's on its way, Austin. It has arrived.
Mm,
Sent the letter, lengthy.
Okay, I'm gonna forward it right now.
I just did.
Oh, you got it?
Well, I just sent it over to Austin again.
Okay, yeah, here it is. I just scrolled down.
Yeah, I was gonna say scroll down a bit.
Hello, Board of Health, right? Sitaraman Ganesan.
Yep.
Is that who it was from?
Yep, and then just read the address. I think is at the very bottom, actually.
Oh, yep. Okay. 28 Seaver Farm Lane, South Grafton, Mass. Sitharaman Ganesan. And he writes to us, Dear Board of Health members, thank you for your service. Not many people know that we got brown, dirty, rusty water on September 21st, 2020, water picture attached. Due to hydrant flushing work performed by the Grafton Water District, it appears the water line that goes on the Milford Road and all the other connecting roads nearby got affected. This is not the first time this is happening. On October 15th, 2019, we got brown, dirty, rusty water at that time. It was not hydrant flushing. Town of Grafton paved Milford Road on October 14th, so that was the day before. It appears that they used water from the hydrant and caused water agitation. It was a holiday weekend at that time, and the GWD could not communicate with their customers. I was told by the Grafton Water District, Millbury Street, that their office is so small that they can't send alerts or emails ahead of time. After calling them, they posted a message in their Facebook page about the brown, dirty, rusty water problem. They were not sure what was going on when I called them about the brown, dirty, rusty water issue. After customers calling, they found it was due to hydrant flushing work that they performed. They also posted a message in their Facebook webpage saying pool company may be stealing water from the fire hydrant. I know the Grafton Water District is a separate entity and not under our local government. Why am I saying all these? For a reason to create public awareness about the issue. It will be nice if people can be alerted ahead of time so that we can avoid accidents by not consuming brown, dirty, rusty water. Can the Board of Health advise the GWD to alert people ahead of time through proper channels, maybe a text via the town administrator, so that we can avoid accidents by not consuming brown, dirty, rusty water? Since the Grafton Water District does business in our town, I assume they should follow state and local government rules to communicate with their customers if the water quality is going to be bad or not usable. They should use a proper channel to communicate on time, not after the event, but before the event. Posting a message in Facebook page is good, but it will not be good enough because not everyone is on Facebook. Also, is there any way the Board of Health can keep an eye on the quality of water that we receive through the pipes? After seeing the water color like this many times, I am not confident to use this water for drinking. Thank you. I mean, I guess we could advise them to alert people. They should be alerting people.
We do not have any power
Right.
over the water districts in town.
You know, I think in Westboro right now, there's a sign out on one of the roads saying they're flushing the hydrants. And I do think to some degree this is a predictable phenomenon when they do that. I don't know about people stealing water for pools and things of that sort. But I'm not sure you can equate it with being unhealthy water. It's you know, it does have, you know, it's unpleasant to look at and so forth, but I'm not sure that it's, you know, he's assuming that it's somehow harmful to consume that water. And I would understand why he would feel that way, but I would think the easiest way to alert people, I don't think people are going to go to your town webpage proactively and look for it. So it's probably more something like putting a sign up at the bottom of the hill, you know, where 122 and 140 are, and maybe also in South Grafton and so forth, saying we're going to be flushing, you know, the fire hydrants, and it will lead to discoloration of the water, and don't worry because the water still meets criteria for being potable or something.
And that's what the town has done in the past.
Yeah. Yeah, and I think that's a practical approach, and if we can get that across to the water company, as Karen said, we don't really have the authority to do that, but I think if we could either forward a copy of that letter and say, this is out of our jurisdiction, however, call the head up and say, do you think maybe you could post this? And
at least be proactive about it, you know.
Right.
Yeah.
Because I think it's going to be a recurrent sort of thing. I mean,
Right.
Yeah, it sounds like it's recurred.
Right.
That's just this one individual.
well, I think our water was discolored last week, I think.
No.
Right. Ours was too, and I had a glass shown to me, and apparently it was my fault. I don't know how that was, but
On the Board of Health.
right.
Therefore, it's your fault, Dan.
Yeah, right. So you pick your battles. I took the rap. I said I'd get it straightened out.
Graciously,
I did
Right.
I'm sorry. Karen, I did speak with the water district, and like they said, just keep flushing and it'll go away.
Yeah.
And just running your faucets, it will go away.
Yeah. But some
I
public
think they
notice
have
would be
to-
nice.
I think what they have to do is reassure people that it's not somehow a health hazard.
Right.
You don't have to boil the water. You don't have to, you know,
You don't have to filter it. You don't have
Yeah.
to.
Wait
Right.
for it to settle.
right. And there's certainly a lot of regulation of water quality. So even though it may not come under our jurisdiction, it does come under
Yeah.
pretty heavy regulatory jurisdiction.
Oh yeah, they have to follow a lot, to say the least.
Yeah, but it's just a matter of practical communication, and maybe we can make a phone call or stop in and talk to them. I think we can work that out.
At least before the next.
Oh.
Right.
Hydrant flushing, yeah. We send them an email to start off with, just saying that we've had some complaints and
Yes, she knows that. I spoke with her last week when the email came in.
Alright.
totally.
All right, so then last up is upcoming meetings. So we have November 2nd, December 7th, and December 28th.
Which is a question mark.
Virtual signing party.
We'd be brainstorming ways to sign the documents by then.
I'm sorry, Austin.
Should
I
we
didn't hear
be brainstorming some ideas on ways that we could all meet individually to sign these on the 28th if we're not going to be in person? Try to come up with some ideas for the next meeting.
And I think, Nancy, you were talking about maybe seeing what Cindy thinks, you know,
Yeah.
since they have
Yeah,
a bunch.
I know some local boards have the signature stamp. For when cases like this happen. Let me check around.
I would say maybe, yeah, that group that you're part of, besides talking with Cindy and stuff, see if, you know, the others that you collaborate with on a regular basis in towns have, you know, understanding they might have some type of electronic system, et cetera, in certain places, but seeing, you know, for those that do not have an electronic system in their town yet, they too will be in this fund soon. You know, have they started to think about it? Have they already come up with a solution that works for them?
Okay, I can do that.
All right, that was it for the agenda.
This is Dan. I guess if no one has any other information, I do have a score of the Patriots are losing 6-3, but
Oh, no.
2 minutes left to the half.
Thanks a lot, Dan.
With that, I'd like to make a motion to adjourn this. I'd like to make a motion to adjourn the meeting.
I'll second that motion to adjourn the meeting.
All right, all in favor, roll call.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gustowski, Govan, aye. Well, have a good evening.